Hi there, welcome to RowPhysio.com podcast. I'm Greg Spooner, physical therapist, San Diego, California. I'm here in Bellevue, Washington at Brand Performance Medicine with Dr. Erik Brand, who himself, just like me, has been rowing for many years. However, this guy has been to the top national championship at University of Washington, won the Oxford-Cambridge race, now double board certified. I mean, I've probably hit about 10% of his accolades. Really thrilled to be here today to chat briefly with you and with Dr. Brand so we can share some exciting tips and strategies to help you row faster, feel better, and be stronger. Erik, thanks for coming on.
Yeah, thanks for having me.
Can you give a little bit more appropriate background as to who you are?
So as you mentioned, my name is Dr. Brand. I'm a double board certified subspecialist in sports medicine with a background in physical medicine rehabilitation. So what that means is my goal is to help you get as functional as possible, quickly as possible, long-lasting as possible, with as much respect as possible for your time, energy, money, and hope to invest your resources like I'd want to invest mine as efficiently as possible.
Dr. Brand, you work with a wide range of athletes from here in Bellevue and around the Shining area, the weekend warriors and casual athletes, all the way up to you were just in Rio a couple years ago, right? Working with the national team. What do you feel like is your strategy or your advice that you tend to give that I would anticipate sort of spans the generations, spans the skills to create a more healthy, resilient, stronger, happier athlete?
I like to put the athlete in better control of their situation and sort of understand the machine that they're running around in through education about the anatomy and physiology of our bodies and how to work cooperatively with our bodies to get the most out of it.
Can you give an example for a viewer like you, where you had somebody come into your office, or you happen to see them as they're coming out of their heat, in London, and they say, "Gosh, I'm feeling this. I'm really concerned."
Right.
What's your approach to trying to kind of get them dialed back in?
Well, one of the first things I like to do with a patient is to really validate what they're going through, which is typically a pain experience. And encompassing the whole person, which may include a process of mourning, a mental emotional injury, really looking at the whole person and the context of the injury that they're dealing with to really try to alleviate fear, unmedicalize the situation, and put the patient back in control as much as possible.
So, one of the things that I just thought of as you were describing that was, let's say you're in the middle of a 2K and you are 1,375 meters into your race, a place that we
hating life, yes,
would appreciate to not be in at that particular point, especially if it's a tight race. And so the body will zone in and almost, it's like you'll forget what's happening. And it isn't until afterward, maybe you get out of the boat, you're getting the boat back up out of the water, and your back hurts. Maybe you feel like you strained something or pulled something.
Right.
On the physical therapy side of things, and they come to me,
right,
my approach is going to be, okay, I want to help the athlete understand what's going on with them, with you, and try and take this really just difficult, convoluted mess of anatomy and help it make as much sense as possible, so that way there's like a sense of ownership. So when I say, okay, here's what needs to happen, here's what would be really beneficial for you to do, let's go this route. How does that compare, or how do you augment in regard to your recommendations for, say, medication or ice or rest or exercise?
Well, the first thing I try to do is recognize that the world's expert in that situation is sitting in front of me as the patient. I'm a doctor and I'm highly qualified. However, the person who's been living this specific situation 24/7 for sometimes an extended period of time is the person in front of me. So I try to put them in a position of power listen very carefully to their whole situation, and not just listen long enough that I can give them an answer, but really listen long enough that they feel heard and validated and in control of the situation, which I find oftentimes happens through discussing the anatomy and the physiology of what's going on, sometimes normalizing the situation, whether it's some degenerating cartilage or some back pain, talking about how common these things are and how they don't necessarily need someone else, such as a doctor or a physical therapist, to do health to them, that they are really in control of many things that can be used to get back in action.